Good afternoon, ladies. My name is Daniel Isaac, and this is Podcast for Life. Good afternoon, ladies and gentlemen. My name is Daniel Isaac, and this is Podcast for Life. And today we are going to be exploring uh, rapid cycling, where mood swings. Now, mood swings is a symptom of bipolar disorder, and it also can be a symptom of schizoaffective disorder as well. I myself suffer from mood swings quite often, and the treatment there with dealing with mood swings is psychotherapy and medication management. Peer support is also very helpful in combating and learning how to cope with the mood swings that can be found in bipolar and to an extent in schizoaffective disorder as well. Ladies and gentlemen, let us not couch words here. Mood swings, when you experience them, it is very confusing and it can be very overwhelming. Oftentimes, if the moods are swinging fast enough, you really don't know what you're feeling. You don't know whether to laugh or cry. You don't know be happy or sad. You, it is a total state of confusion. And when they are swinging that fast, going from the highs of mania to the lows of depression, and they are just doing nothing but going back and forth. And they can do that several times a second. And it can be so fast that you are virtually feeling happy and sad at the same time. Or at least it can be perceived that way. But trust me, it is you're progressing from one side to the other very quickly. And like I said, it creates a sense of confusion because you don't know if you're supposed to be happy or sad. You have all kind of thoughts that come into your head, both that make you happy and that make you sad. Also, that irritate you and make you angry. Some people experiencing mood swings have also uh, reported that the mood swings make them feel like they're jumping out of their skin. I can see that. Having experienced rapid cycling myself, I can see how it would be overwhelming and make you want to get out of your skin. You really, when you're experiencing rapid cycling mood swings, all you want to do is just slow it down. It's not that you want to stop the progression, you want to feel. You want to feel good when you need to feel good, and you want to feel bad when you know you need to feel bad. It is one that is rapid cycling that you don't know how to feel. You don't know what you feel. It is very difficult to pin it down. Does it feel like you're happy and sad at the same time? Yes, it can. It can feel like you're both happy and sad at the same time, Or it could also feel like you can't decide whether you're happy or sad at the same time. Now, bipolar is a dangerous illness. It is prone to suicide, suicidal thoughts, so schizophrenia, schizoaffective disorder. Schizophrenia and schizoaffective disorder, you add in hallucinations. We're not going to go into hallucinations in this episode. We're just going to concentrate on the mood swings. Now, the thing is mood swings are not as pervasive in schizophrenia as it is in schizoaffective. What is the difference between schizophrenia, schizoaffective, and bipolar? I'm hearing you people ask right now. Well, let's take a look at a scale. We'll put schizophrenia on one end of the scale. We'll put bipolar on the other end of the scale. Where schizoaffective fits in is right between the two. And it could be anywhere between the two. You know, it could be more bipolar or it could be more schizophrenia. But schizoaffective generally has the elements of schizophrenia and the elements of bipolar as well. And as with any illness, especially mental illness, it takes a trained professional to be able to make a diagnosis. It takes a licensed therapist, master's level education degree, or higher, doctor, medical doctor can make a diagnosis. PhD can make a diagnosis. Make sure your PhD is a certified psychologist or psychiatrist. And that way there you know you're getting proper diagnosis. An MD can make a diagnosis, and most MDs that I know, unless they are in the mental health field, they do bounce it off people that they know that are in the mental health field, just to make sure that they are correct. The beginning of wisdom is realizing you don't know everything. Doesn't mean you know nothing. You might know enough to be dangerous to yourself, to others. But what you need to do is realize, hey, I might not have all the answers. And not to be afraid to ask somebody when you have a question. I find myself doing that more and more each and every day. And it seems like the more questions that I ask, the more help that I get. And the more help that I get, the more informed my responses can be. In our hurry up and wait culture, we need to learn to slow down and take it easy and keep everything in an even keel, especially those of us who suffer with mental health challenges. I find that although I'm trying to slow it down, every once in a while, I'll let the tempo of my work take over, and then I want to get done faster and faster and faster. That's not the way to do it. We have to be, those of us who suffer from mental health challenges, we have to be the master of ourselves. We have to be the master of our destiny, and we have to be the master of our environment. It takes a lot of discipline to sit there and say, okay, I feel like hurrying up, but that's the worst thing in the world. I just got to slow down a little bit. It'll all get done. Positive self talk goes a long way with that. We'll get more into positive self-talk in future episodes. Actually, I may look forward to that one. Ladies and gentlemen, we're talking about rapid cycling that is found in bipolar disorder. We're talking about mood swings. Now, to give you an illustration of what a mood swing is, I want you to get comfortable, prop your feet up, lay back, close your eyes, and think of the happiest memory that you have. Go ahead and enjoy it for a minute. Okay? Now, as you remembering that happy memory, interrupt it with the worst memory that you have. What is the worst thing that happened to you? Now, as you transition from the happy memory to the sad, unhappy memory to the sad memory, you feel your mood shifts. That is a mood swing. For most of us, it can take up to 15 to 30 seconds or more to complete a mood swing. Or it can take more. There are diagnostic criteria that need to be met that you need to attain to call it rapid cycling or a true mood swing to suggest that there's a mental health issue at stake. There are several criteria that therapists, doctors use in symptomology and in the reported experience of the patient. That's why it takes a trained professional or a doctor to be able to diagnose. And they have tools, the DSM-5 diagnostic statement module that lists all of the symptoms for all the illnesses. And for many mental health illnesses, symptoms do overlap. Same, you have the same symptomology. It could be several things. But the combination of the symptomology is unique to each condition. Are you more happy or more sad? Are you not even? Do you go back and forth? Do you rush? Do you see things? Do you hear things? Do you have hallucinations? A lot of people are put off by a therapist's apparently intrusive questioning. But mind you, these questions, even though they don't seem relevant, they're quite relevant because every question is structured to either bring about a response or to bring about an answer. Any therapist, even question, may question the patient about the sky being blue. They may assert, to see what the reaction is, that the sky may be green. And they're looking for a response on that. They're looking for a certain response. They're not looking for somebody that'll agree with them. What they're really looking for is somebody that'll disagree with them, but have a good argument. And it's how they structure that argument is telling about where they're at, how they're doing. The thing is I'm suspect with any therapist that sit there and say, I can diagnose anybody in 15 minutes. Personally, I think it takes at least a half hour to even begin to understand who you're dealing with. So it could take up to an hour to even get an idea about the diagnosis. I have more credibility with therapists that will sit there and say, well, as far as I know, this diagnosis fits. And where they're not afraid to revisit that. Sometimes each visit, sometimes monthly. The most credible therapists I've seen do reviews of the chart, of the diagnosis, of their own work. Go back through your notes, and every so often you're seeing a patient on a monthly basis. You might be seeing 50 patients. It's good to refresh your memory. Yeah, I know you can keep a certain amount of memory on the tip of your brain, but it's good to go back and take a look and make sure you're on the right track. Now, as a peer support specialist, I work closely with my consumers, and in working closely with my consumers, I could probably rattle off all the aspects of each one of them. But I do need to keep confidentiality between them. The last thing I need to be doing is to be working with one thinking that I'm with another one. Currently, my caseload is about 13, and I myself, I go back through my notes every so often, about 2 to 3 months. I go back through my notes to make sure that I'm being consistent. I can just imagine what these therapists do when they're seeing 50, maybe 100 clients, and they got to keep them all straight. Uh, I got to confess, sometimes I do have trouble keeping 13 straight, but I do it more often than not. And when I'm doubting that, I go back through the notes and I make sure I check, double check, and triple check, make sure I know how I'm doing. And I do it before I get to a problem. If I've gotten to a problem, that's failure on my part to properly pay proper attention. But like I said, 13 is not bad caseload. And I see him several times a month. There's no real set limit. There's high end limit. And I do need to see him at least once a month. But past that, there's no real limit. And right now, 13 is a good number based on the needs of my clients. And no, I'm not going to go into any of the details. That would be a conflict of my interest and a breach of confidentiality. I'm not going to do that. Now, if any of you would like to discuss your experiences with mood swings or which mood swings, the boxes are open. Let's go ahead and grab a spot. If you're not on Get Vocal, GTVOKL.com, then you're welcome to call in. Phone number is 606 545 2019. Now, I've kind of explained to you what a mood swing was. So I've given you a bit of a primer. Let me go ahead. Now, I have found information at healthyplace.com. And I'm taking a look at this uh, website, and it looks like that this website is probably one of the better ones as far as giving information. Just like any website, it is only a beginning. You do the research, you get to know what the problem is, and then what you need to do is to go to a professional and then ask your questions based on what you've read. You know, is it something that applies to you? Is it something that could apply to you? Is it something that applies to your loved one? Whether it's you get receiving services or you're desiring of somebody else receiving services, it doesn't matter. Most health professionals will be happy to talk to you, especially generally or specifically. And if you're someone who's interested in bringing another person to treatment, working with a professional yourself would give you a hands up and a place to ask questions, to get answers, and to augment your skills in attempting to bring your loved one to treatment. Now, the National Alliance of Mental Illness is a great place to start. Here in Kentucky, it is NAMI Kentucky, NAMIKY.com. And from there, you find a local affiliate. And then from there, you can find all kind of peer support, all kind of resources. You know, we can point you in the way to probably several professionals, or we may even have a professional nearby. Many of the professionals do belong to NAMI. If you are interested in mental health, check out NAMI. It's NAMIKY.org. Okay. Anyway, this definition of rapid cycling is from healthyplace.com, and it is as follows. Rapid cycling bipolar disorder can be a dangerous condition and carries high risk of suicide. When a person with bipolar experiences four or more manic, hypomanic, or depressive episodes in any 12-month period, it is defined as rapid cycling bipolar. While the term rapid cycling may make it sound as if the episodes occur in regular cycles, episodes often follow a random pattern. Because of the rapid mood swings associated with this type of bipolar disorder, the individual may feel as if they're on an emotional roller coaster, swinging from the highs of mania to the depths of depression, and all in the course of a few days or even hours. Any type of bipolar disorder can be rapid cycling, but people with bipolar disorder rapid cycle. Bipolar disorder is characterized by episodes of bipolar depression and either mania or hypomania, as in the case of bipolar type 2. Episodes must last a minimum length of time 4 days for hypomania, 1 week for mania, 2 weeks for depression. While those are minimum lengths of time, many people with bipolar disorder spend more, sometimes considerably more time in an episode. On average, people have between 0.4 0.7 episodes per year, lasting 3 to 6 months. Between episodes, there may be periods of normalcy. without an elevated or depressed mood. Rapid cycling bipolar disorder is the dramatic speeding up of these cycles. Rapid cycling bipolar disorder symptoms and effects. While the DSM-4 only defines one type of rapid cycling, particularly short cycles are also known to occur. Ultra-rapid cycling denotes episodes lasting days, and the ultradian indicates multiple episodes per day. Rapid cycling bipolar disorder can be more difficult to detect than standard bipolar disorder, as patients, particularly those with a short hypomanic cycle, may see hypomania as simply a rare good mood rather than an actual mood episode. Since they spend more time depressed, they are often misdiagnosed with depression. The hallmark symptom of rapid cycling bipolar disorder are mood and energy changes that are out of control and disabling. The person may experience severe irritability, anger, impulsivity, and uncontrollable outbursts. Okay? And then it goes on and explains about the treatment, and the um, treatments basically is medication management and psychotherapy. Peer support can help with support, encouragement, and learning to cope. I myself was diagnosed with bipolar disorder before I received my current diagnosis, schizoaffective disorder. And I know all about it. I know all about living with it. I know all about what to look for and how to stave off the problems. I'm living proof that recovery is possible. For recovery to happen, three things must happen. Number one, we must want to recover. Our desire to recover and live a more normal life. Our desire goes a long way toward our recovery. The second thing that needs to happen is we need to be hooked up to therapy and medication management and a minimum. Now, depending on the needs and insurance, a number of other factors, there are other services, case management, peer support, and it's all helpful. Nursing, it's all helpful. And more services that people can get, the better they are, the better they can cope, the better they can learn. The third thing that needs to have happen is we need to put it into action. We need to do, we need to first learn what we must do, and then we need to set about doing it. And once we have mastered the skills and we have brought ourselves to a point of recovery, to where our recovery itself is stable, then we can go on and move beyond the illness and teach others how to recover and live a life of recovery. Now, mind you, serious mental illness, depression, bipolar, schizophrenia, schizoaffective, serious mental illness is a lifelong proposition. There are times that you get better, and then there are good times times that you get worse. What we want to do is maximize better. The times that we're living, if not a normal life, a near normal life, where we can achieve, where we can be who we are, what we are, and how we are, where we can be a part of society and not apart from society. We can be a part of society. We can live, grow, work, and learn according to the talents that God has given us. According to the talents. Yeah. I'm sorry, ladies and gentlemen, one of my mentors or role models, whatever you want to call them, has recently died. I'm struggling with that. And I just got caught up in a thought regarding him. Our talents are indeed on loan to us from God. Whether you believe in God or not, that's where our talent and our creativity comes from. Faith goes a long way. And in one of these upcoming episodes, we're going to delve into how faith affects your mental health and affects it in a positive manner. And we're also going to talk about positivity. What else? There's so many things that we're going to talk about. And if you miss a week, I'm sorry. You need to try to keep up. We're going to be over the next couple of months. We're going to be going over a lot of material, and I would like to have some audience participation. If you're experiencing any of this and would like to speak on it, ask questions about it, just keep in mind it's you and me and the rest of the world you're speaking to. I'm not going to ask your name or anything, but if you do care to give, we'll know what to call you. The thing is this podcast here is I want to be encouraging and uplifting for everybody, including myself. In the light of current events, I want to be an encouragement, be lifted up, be a help, a light in the dim tunnel. Support and encouragement, that's what great support is. Learning how to live life and learning how to live life more abundantly. Faith has a lot to do with that. We'll discuss that in future episodes very soon. Right now we're talking about rapid cycling. Now the thing is a lot of people may be sitting there going, okay, my mood changes several times each day. How do I know that it's a problem? Well, if your moods are impacting upon your life, if you are going one extreme to the other, or even not, if you're going toward irritability, you can't stand yourself, if your moods are impacting your life in a negative way, if it's keeping you from doing what you want to do. We all get happy and sad at times. Things happen that make us happy. Other things happen that make us sad. Grief is a big one. Somebody dies, we miss them. We grieve for them. Somebody steps out in our life, we grieve for them. It's a sense of loss. Makes us feel bad. There's nothing wrong with feeling happy, and there's nothing wrong with feeling sad. But it's when the feeling happy, feeling sad start to interfere with our life. When we make questionable decisions based upon our moods. And when it comes to making decisions, we really shouldn't be basing our decisions on about our emotions or on our moods. We need to be making those decisions more logically. This is where I want to get to. This is my goal. This is the step to my goal. Now, how do we get through the step to get to the next step? That's how you do decision making. I feel good today, so I'm going to have some chocolate. Okay. Well, I'm rewarding myself for feeling the way I want to feel. So I do enjoyable activity to reinforce that. Let's try to be positive. Let's try to do positive things together. Now, I've told you about what rapid cycling is. It's okay to be happy. It's okay to be sad. But when they start interfering with your life, then it's time to see a professional, a licensed therapist, clinical therapist, or a medical doctor, or a psychologist, psychiatrist, PhD. Those are the people that can make diagnoses. And if you're questioning whether you may be suffering from mental illness, then please let me encourage you to go in, get an evaluation. Many clinics, the evaluation is free. Other clinics, it's a minimal charge. While we make those decisions, let's try to do good to each other. Let's try to be good to each other. Let's try to do what we can for each other. Until next week, this is Daniel Lassett. This is Podcast for Life.